And let the DCI people do their part.
Jeff Kirui, KTN News.
Jeff Kirui for that. Now, the Kenya Union of Clinical Officers has escalated its war with the Social Health Authority Board, accusing it of excluding clinical officers from providing essential healthcare services. The clinicians held demos in Nairobi and headed to SHA and Health Ministry to lodge their complaints about the exclusion. But even as they protested, their fellow colleagues under the KMPDU umbrella also threatened to down tools over unmet demands. Our health and science reporter Chebet Birir has more details.
Tabibu power. Maafisa tabibu power. Afya power.
In a memorandum addressed to President William Ruto, KUKO officials claim that the SHA board has deliberately marginalized clinical officers by refusing to contract facilities operated and registered by the Clinical Officers Council. According to KUKO chairperson Peterson Wachira, approximately 1,200 facilities previously contracted by the National Hospital Insurance Fund (NHIF) have been stripped of their service contracts under the new Social Health Authority. The union argues that this exclusion effectively denies healthcare access to nearly 6.3 million Kenyans who rely on specialized clinical officer services. Wachira termed the board's action as illegal and driven by vested interests and corruption.
A majority of the private facilities in the country are owned by clinical officers. But when Dr. Abdi and his team sat illegally against the SHA Act, against the Health Act, against the Clinical Officers Act, they decided they are not going to empanel and contract facilities by clinical officers.
Key allegations include the board's insistence on only contracting facilities registered with the Medical Practitioners, Dentists and Pharmacists Council (KMPDC), despite existing laws mandating recognition of facilities registered by the Clinical Officers Council.
Clinical officers are the backbone of primary health care, and primary health care is about going back to the roots, going back to our level 3s and our level 4s.
We are not going to wait until Kenyans die anymore, and this should be reasoned so clearly by our president so that he can be able to instruct the people who are mandated to make the right decisions for us. So healthcare financing is in a poor state in our country.
The union has also criticized the board's prioritization process, which now requires clinical officers to obtain registration numbers from doctors to pre-authorize medical procedures, a process Wachira describes as extortion that forces clinical officers to obtain multiple redundant licenses.
Clinical officer, including specialist clinical officer, are now forced to go through an individual who are registered under the KMPDC. Meaning, if I'm today at work and I'm seeing a patient who need a procedure that I can single-handedly handle, I cannot go ahead and perform unless I seek pre-authorization through an individual who is not at work using their registration number.
Meanwhile, the Ministry of Health says it remains committed to ongoing talks with KMPDU on matters remuneration. According to Public Health and Professional Standards PS Mary Mudhoni, all efforts are being employed by the government to ensure health services are not disrupted.
The government is still committed to the ongoing talks for the human resources for health conversation. You know very well that our interns have been in the field without pay. And right now, the court has given us 90 days to have a conversation with them.
Chebet Birir, KTN.
Let's now talk about road safety.